Hey, it's Dr. Josh. So today I want to talk about the problem with NSAIDs. Now, NSAID stands for non-steroidal anti-inflammatory drug. These are going to be your over-the-counter medications like ibuprofen, naproxen. So ibuprofen is going to be your Advils or your Motrins, and naproxen is going to be your Aleve. And then Celebrex is another very commonly prescribed anti-inflammatory medication. So just because these medications are over-the-counter drugs doesn't necessarily make them safe, and it doesn't necessarily make them a good idea, especially in the long term. I would say that just based on statistics, NSAIDs are the most commonly consumed but also the most commonly abused medications out there right now. And we're going to talk about why they're not necessarily the best idea to take, especially long term. So first things first, we need to really understand that taking NSAIDs like Advil, Motrin, or Aleve, it's not going to fix your problem. They just cover up the problem, right? So I'll have patients that have come into my clinic and they've taken 8 to 12 tabs of Advil every day for years and years and years, right? So the fact that they've had to take these medications for long periods of time shows that just taking them and consuming them doesn't actually fix your problem, right? So what they do is they're kind of like a Band-Aid in the sense that they don't actually fix your problem, and you can take them for the rest of your life and still have pain. So they don't do anything to actually help you heal better. And two, the big problem with taking NSAIDs is they actually delay the healing process. Now, this is a really important thing to consider when you get an injury, right? So let's say you sprain your ankle. The first thing most people do is they pop a few Advil to try and dull their pain. Well, here's the deal. When you do that, taking these NSAIDs, it stops the first phase of the whole healing cascade, the whole healing process. And it blunts your body's ability to fix itself, to lay down new collagen fibers, right? We have to go through a bunch of stages of what we call the healing cascade, and if you stop that right at the first step, then the other steps don't get to actually express themselves, and it can be a real problem. It can lead to actually causing the collagen fibers that your body's supposed to lay down to become weak, right? And over time, this can lead to things like arthritis. So taking NSAIDs, especially after an acute injury, might not be the best decision because it can actually delay the healing process, and it can make your joints and the ligaments and tendons that surround them weaker. So we want to always consider that. And the third thing to think about when you're thinking about taking NSAIDs, they're just not as safe as you thought they were, right? So studies show that taking NSAIDs like ibuprofen or Aleve or Celebrex can actually lead to a 31% increase in heart attacks, right? That's pretty significant considering the fact that heart attacks and cardiovascular disease is always in the top 2 killers in America, right? So increasing your chances of a heart attack is probably something that you don't want to do. So you need to take that into consideration. 2, taking NSAIDs for a long period of time can lead to bleeding in your intestines, right? Can lead to GI bleeds. And every year there are over 100,000 plus hospital visits from spontaneous GI bleeds due to people over-consuming and taking things like these NSAIDs. So they can cause stomach problems. And the third thing is that they can be really harsh on your liver and your kidney. So just because it's over-the-counter doesn't necessarily mean it's safe, right? It can increase your risk of heart attack or GI bleeds, and it can screw up your liver and your kidneys. So NSAIDs are not necessarily the benign pill that you've been led to believe, right? They don't actually fix your problem. They can delay the healing process, and they can cause you to develop arthritis long term, and they can actually be pretty dangerous. So you need to consider these facts when it comes to taking NSAIDs. You don't want to take them long term. Sometimes they can be useful in short-term acute situations. I'm not saying not to take them, but I am saying that you need to consider their effects in your body before you take them, and especially before you take them for a long period of time. And you don't want to be taking excessive amounts of medications that can be dangerous and that can actually delay your healing process. The good news is there are better alternatives to NSAIDs. There's a bunch of all-natural medications and supplements and herbs that can provide anti-inflammatory and pain-killing properties. And I'll talk about those in another video, but I just want you to know that there are some problems with taking NSAIDs, and now you're better informed. If you have any questions, you can head on over to my website at Hanson Complete. I have a bunch of articles that can go into more detail on some of the supplements that might be effective for you. So I hope that gives you some clarity and gives you some information, and I will speak with you soon. Have a great day.